practice questions in regards to the anatomy and different disease processes found within the gastrointestinal system. As with all of our practice question videos, I ask that you pause the video after we initially go over the question and answer options. That way you can come to the correct answer independently, and then you can resume the video for us to review the rationale together. All right, this is a multiple response, select all that apply style question. It will test your knowledge of physiological integrity. The nurse is caring for a 45-year-old male patient admitted to the digestive health unit for acute onset jaundice, a gray-blue discoloration of the periumbilical area, reports of peripheral neuropathy, abdominal pain, and vomiting. Current vital signs as follows: a temp of 100.2, heart rate of 102, BP 94/50, and O2 is 97% on room air. Which of the following are consistent with the diagnosis of acute pancreatitis? Select all that apply. So what are the signs or symptoms of acute pancreatitis? A fever, peripheral neuropathy, tachycardia, hypotension, or abdominal pain. And just remember that gray-blue discoloration, it's called a Cullen's sign when there is discoloration of the periumbilical area, and then it's a Turner sign when there's a bluish discoloration of the flanks, just as a side note. So going back to the question, select all of the following that are consistent with a diagnosis of acute pancreatitis. So, signs and symptoms of acute pancreatitis include abdominal pain, nausea, vomiting, that gray-blue discoloration of the abdomen, especially around the umbilical area, fever, tachycardia, and hypotension. All right, this is another multiple response, select all that apply, and will test your knowledge of physiological integrity. So the nurse is providing care for a 13-year-old patient who has been admitted for observation because of moderate abdominal pain, loss of appetite, and symptoms of nausea and vomiting. The nurse is currently examining the patient's medical record and notes the following. So this 13-year-old patient has a temp of 101.2, a heart rate of 70, and a BP of 104/66. The nursing notes at 7:30 a.m. state that an abdominal CT resulted in an enlarged appendix with inflammation. Potassium and sodium slightly decreased. Other labs were within normal limits. The abdomen is slightly more distended than prior. The patient reports that the pain is increasing, temperature is increasing, and nausea is well controlled with an IV antiemetic at this time. The nurse discusses the plan of care with the surgical resident on call. Which of the following physician orders should the nurse anticipate? Select all that apply. So I want you to analyze this medical record and try to predict what the treatment plan is going to be for this 13-year-old patient. And based on that prediction, which of the following orders can you as the nurse anticipate from the physician? All right, so you would come to the conclusion that the patient likely has appendicitis and is going to require an appendectomy for treatment. The surgeon or the surgical resident is responsible for explaining the procedure, the risk versus the benefits, and responsible for obtaining the informed consent, not the nurse, but the surgeon or the surgical resident on call. The nurse then prepares the patient for surgery by reinforcing teaching and completing, the preoperative checklist. The procedure is assumed to be performed laparoscopically as there are no complications present. If the patient had, say, peritonitis, then it may need to be an open surgery, but since there are no complications, we're going to assume that it's going to be performed laparoscopically. So there's no indication for the need of red blood cells at this time. Her nausea is well controlled, so there's no need for the placement of a G tube, an NG tube. All right, this is a drop-down style question. It will test your knowledge of physiological integrity. A 75-year-old male patient presents to the emergency department with acute left upper quadrant abdominal pain, reporting a recent cholecystectomy times 2 weeks ago. The nurse performs an admission assessment and reviews ordered imaging and lab results. The nurse notes the following: a white count of 16,000, glucose of 102, ALT of 80, AST of 86, PC 11.4, INR 1, amylase 800, lipase 320. The CT of the abdomen resulted in edema of the pancreatic head, consistent with acute interstitial pancreatitis. And at about 9 a.m., the nurse noted that the patient's lungs were diminished to auscultation bilaterally. O2 is 89% on room air. The patient was tachypnic with a respiration rate of 26, and BP is 158/78. Based on the above information, the nurse determines that the patient is at highest risk for developing blank, a complication of acute pancreatitis, as evidenced by blank. So based upon this information given to you from the patient's medical record, you conclude that the patient is at greatest risk for developing what from options for 1, and what is that evidenced by, and look at your options for 2. All right, so the patient is presenting with acute pancreatitis as evidenced by the lab results and the CT results. So while pulmonary edema, coagulation deficits, and atelectasis are all potential complications of acute pancreatitis, older adults are more at risk for developing atelectasis and resultant pneumonia. So his tachypnea, his O2 sats of 89%, and diminished lung sounds all point to a diagnosis of atelectasis. All right, so this is a multiple response style question, a select all that apply, and will test your knowledge of physiological integrity. The nurse is providing teaching to a 23-year-old male patient with a new diagnosis of GERD about specific food items to avoid. Which of the following should the nurse include in her teaching? Select all that apply. So which of the following should a patient diagnosed with GERD avoid in their diet? Carbonated soda, chocolate, peppermint, 2% milk, fried chicken, raw fish, or sushi. All right, so foods that decrease the lower esophageal sphincter pressure and irritate the esophagus will therefore increase reflux and exacerbate the symptoms of GERD, and therefore should be avoided. So these aggravating substances that patients with GERD need to avoid include coffee, chocolate, peppermint, fried or fatty foods, carbonated beverages, and alcohol. Options D and F do not promote this effect, and so therefore do not need to be avoided. All right, another multiple response select all that apply style question. It will test your knowledge of physiological integrity. The nurse is caring for a 22-year-old patient that is on the post-operative surgical unit after a laparoscopic cholecystectomy. The nurse performs an assessment and notes the following. The patient is alert and oriented times 4, temp is 98.9, O2 is 97%, pain is a 4 out of 10, the dressings are clean, dry, and intact, and the patient has not yet voided since surgery. The nurse should take which of the following actions in caring for the patient in the post-operative period? Select all that apply. Assist the patient to the bathroom to urinate, assess those incision sites frequently, maintain a strict NPO status for nothing by mouth, administer pain medication, encourage use of the incentive spirometer, or keep the head of the bed elevated at 90 degrees. So which of these is the nurse going to implement in caring for this patient in the post-operative period? So, care of the patient in the immediate post-op period includes keeping the head of the bed elevated at approximately 45 degrees, not 90. So, you want to avoid placing stress on the incision sites, and that's going to, with the head of the bed elevated at 90 degrees, that's going to place a stress on those sites. So you want to keep it at approximately 45 degrees. This is going to help prevent aspiration. It's going to help to promote comfort. The nurse is also going to want to assist the patient to the restroom to void. You do want to assess those incision sites frequently. You would give antiemetics and pain medications as needed. You would also encourage the use of the IS to aid in the prevention of atelectasis and potential pneumonia. An NPO or nothing by mouth status is not necessary, but of course you do want to wait until the patient is alert to offer any food or water to decrease that risk for aspiration.